During abrasional injuries of epidermis, at this level, can cut the tips of papillary dermis, which is vascular, and show pointed bleeding spots on the injury. Pigment deposition using a needle into dermis is tattoo. Basal cell carcinoma arises from stratum basale. Squamous cell carcinoma usually arises from stratum spinosum. Melanoma is cancer arising from melanocytes, which is pigmented. In first degree of burn, only epidermis is involved. Example, sunburn. In second degree of burn, epidermis and part of the dermis is involved. In third degree of burn, both epidermis, dermis, and even some part of hypodermis is also involved. Patchy loss of pigmentation on the skin is a condition called vitiligo due to no pigment formation by melanocytes. Albinism is a genetic disorder that impacts melanin production. Skin, hair, even pupil of the eye are hypopigmented. Subcutaneous injections are given in hypodermis, usually hormonal injections. Example, insulin. Intradermal injections are given in the dermis itself. Example, BCG vaccine. In intramuscular injection, needle goes perpendicular to the skin deep into the muscle. Injury to cells in the epidermis or separation of epidermis from dermis can result in blister formation. Langer lines, cleavage lines, or skin tension lines are topographic lines on the human body which represent the direction of collagen fibers in the dermis of the skin. Orientation of these lines is different in different parts of the body. Usually they are parallel to the muscles which are underneath. What are the importance of these lines? Surgical incisions are always taken parallel to these lines. This results in better wound healing of the skin. If the incision is taken perpendicular to the cleavage lines, cut edges of the healing skin will show gaping because of tension lines. Overactive secretion of sebum and inflammation of the ducts can result in acne. These are commonly seen in adolescents because of hormonal variations. Loss of tension in the collagen fibers of dermis can result in wrinkling of the skin. It is a common feature in old age. The skin having more mobility shows more wrinkling. For example, around the mouth, eyes, and around the joints. Fungal infections on the skin are commonly observed. Epithelial turnover rate in psoriasis is quicker. Normally it is 4 weeks. In this condition, it is 4 days. It results in scaly skin.